After extensive discussions, reflections and deliberations, we hereby adopt the following resolutions as our commitment to addressing GBV through policy, implementation and accountability. Resolution 1. Strengthening legal and policy framework. Review and enhance existing GBV laws and policies to close legal gaps and strengthen survivor protections. Align Kisii County GBV policies with national and international human rights frameworks. Advocate for the fast tracking of GBV-related cases within the justice system to ensure timely access to justice. And work towards establishing a Kisii County GBV policy framework to guide all prevention and response effort. Resolution 2, budget and resource allocation. We have resolved to push for increased county budget allocations for GBV prevention, survivor support services, and legal aid. Develop sustainable funding models, including a partnership with donors, NGOs, and the private sector to expand GBV response programs. Establish a GBV survivor fund to support medical, legal, and psychosocial services. Resolution number 3, enhancing multi-sectoral collaboration. Establish a county GBV coordination committee to foster collaboration between law enforcement, healthcare providers, social services, and community organization. Resolution number 4 is to access justice and survivor-centered services. We have resolved to advocate for the establishment of specialized GBV courts or priority case handling for GBV survivors. Ensure law enforcement officers, prosecutors, judges receive specialized training on handling GBV cases with sensitivity and urgency. Expand legal aid services and pro bono representation for survivors. Strengthen witness protection and confidentiality measures to prevent survivor intimidation. Resolution number 5, mainstreaming GBV prevention in development plans. We have resolved to integrate GBV education programs into schools, technical training institutes, and community awareness initiatives. We have resolved to develop economic empowerment programs for survivors, including vocational training and financial support to help them rebuild their lives. We have also resolved to engage men and boys as allies in GBV prevention through mentorship and advocacy program. Resolution number 6. On monitoring and evaluation and accountability, we have resolved to establish a county GBV monitoring and reporting system to track GBV cases, policy implementation and service delivery, to commit to annual policy reviews and progress assessment to measure impact and address emerging challenges, to set up community feedback mechanisms where survivors and citizens can report concerns and evaluate GBV response effectiveness. And these are our commitments going forward. As stakeholders and duty bearers, we reaffirm our commitment to ending GBV in Kisii County and ensuring that survivors receive justice, protection, and support they deserve. And to do that, we call upon the following institutions to do the following. Number 1, we call upon the county government of Kisii to champion and implement the resolutions outlined in this communique. The second one, we call upon the county assembly to legislate and oversee the enforcement of stronger GBV policies and budget allocation. Number 3, we call upon law enforcement and judicial institutions to prioritize GBV cases and improve survivor-centered response mechanism. We also call upon civil society organizations, religious leaders, and community groups to drive awareness, advocacy, and prevention initiatives at the grassroots level. We call upon the media to amplify GBV awareness, highlight